Aplastic anemia due to bone marrow dysfunction. Bone marrow aplasia means lack of functioning bone marrow. For example, exposure to high-dose radiation or chemotherapy for cancer treatment can damage stem cells of the bone marrow, followed in a few weeks by anemia. Likewise, high doses of certain chemicals, such as insecticides or benzene and gasoline, may cause the same effect. In autoimmune disorders, such as lupus erythematosus, the immune system begins attacking healthy cells such as bone marrow stem cells, which may lead to aplastic anemia. In about half of aplastic anemia cases the cause is unknown, a condition called idiopathic aplastic anemia. People with severe aplastic anemia usually die unless they are treated with blood transfusions which can temporarily increase the numbers of RBCs or by bone marrow transplantation. Blood loss anemia. After rapid hemorrhage, the body replaces the fluid portion of the plasma in 1 to 3 days, but this response results in a low concentration of RBCs. If a second hemorrhage does not occur, the RBC concentration usually returns to normal within 3 to 6 weeks. When chronic blood loss occurs, a person frequently cannot absorb enough iron from the intestines to form hemoglobin as rapidly as it is lost. RBCs that are much smaller than normal and have too little hemoglobin inside them are then produced, giving rise to microcytic hypochromic anemia. Hemolytic anemia. Hemolysis is the premature destruction of erythrocytes. A hemolytic anemia will develop if bone marrow activity cannot compensate for the erythrocyte loss. The severity of the anemia depends on whether the onset of hemolysis is gradual or abrupt and on the extent of erythrocyte destruction. Mild hemolysis can be asymptomatic while the anemia in severe hemolysis can be life-threatening and cause angina and cardiopulmonary decompensation. Megaloblastic anemia. Based on the earlier discussions of vitamin B12, folic acid, an intrinsic factor from the stomach mucosa, one can readily understand that loss of any one of these can lead to slow reproduction of erythroblasts in the bone marrow. As a result, the RBCs grow too large, with odd shapes, and are called megaloblasts. Thus, atrophy of the stomach mucosa, as occurs in pernicious anemia, or loss of the entire stomach after surgical total gastrectomy can lead to megaloblastic anemia. Also, megaloblastic anemia often develops in patients who have intestinal sprue, in which folic acid, vitamin B12, and other vitamin B compounds are poorly absorbed. Because the erythroblasts in these states cannot proliferate rapidly enough to form normal numbers of RBCs, the RBCs that are formed are mostly oversized, have bizarre shapes, and have fragile membranes. These cells rupture easily, leaving the person in dire need of an adequate number of RBCs.